All right, so we're looking at what is known as Kernicterus. So Kernicterus is actually, Kernicterus is a bilirubin problem. All right, so when there's high bilirubin levels in the body and all of that, then all of a sudden this bilirubin is actually is crossing the blood-brain barrier to get into the brain. That's what we regard to as what? Kernicterus. So Kernicterus, you could say, if a baby is yellow, that means there's high bilirubin, right? So it actually there's high bilirubin in the body, but when it starts getting to the brain, that's what we call Kernicterus properly. So it's just a serious form of brain damage. It occurs when excess bilirubin, that's a yellow pigment, usually produced when blood cells are broken down. Okay, so when this Kernicterus is crossing the blood-brain barrier and accumulating in brain tissues, it most commonly seen in newborns with severe untreated jaundice, especially within few days of life. Causes this disease almost always linked to what? Extremely high levels of what? Unconjugated bilirubin in the blood. Right? Premature birth, maybe the mother's immune system attacked the baby. Alright, all those rhesus factor incompatibility. So there was so much of red blood cells that was broken down within a short period of time, producing too much bilirubin. Could be genetic conditions, could be birth trauma, could be poor feeding. Alright, so symptoms is what? Early signs is lethargy, poor feeding, low muscle tone, lack of startle reflex. Okay. Middle stage, the baby is having a high pitched cry, irritability, muscle stiffness. Late stage, having seizures, aching of the back. Right. Coma, which is too severe, the baby can die from it. Long-term complication is cerebral palsy, hearing loss, vision problems, intellectual disabilities, movement disorders. So how can you diagnose Kernicterus? Of course, I've told you guys, it's just a bilirubin issue. So you are checking out for levels of bilirubin in the blood. So transcutaneous bilirubin test, all right, serum bilirubin test, all right. So Kernicterus is typically diagnosed when bilirubin levels are more than 25 milligrams per deciliter. So this is a treatment: phototherapy, exchange transfusion, where you are now kind of like changing the blood of the individual. Then if it is the immune system that is attacking the red blood cells, you give drugs that will suppress the immune system. All right. Then supportive care. The person have issues with feeding, so feeding support, seizure management, and all of that.